One of my friends from Chicago called me last week and said, "Hey, what do you think of these Medi clinics or Medi weight loss clinics?" These are clinics that take obese patients and put them on an 800 calorie diet of just shakes. You literally just drink calories. And they put you on phentermine or Adipex. In certain states like Illinois, it's okay to be on it forever. But they put you on this stimulant that suppresses your appetite, ramps up your metabolism a little, put you on an 800 calorie diet, and here you go. You lose 30 pounds in I don't know how many weeks, like a month or so, maybe a little more than that. But you get like this huge boost of weight loss right up front off the bat, and you feel great obviously because you've lost a lot of weight. But the problem with this is, first of all, you've not adopted or adopted any habits that help you long term. You've lost weight in 30 days, 60 days, whatever it is, maybe 6 months, but you have no tools at your disposal on how to keep that weight off. You didn't learn portion control. You learned how to severely restrict your diet, and because of the Adipex, the medication, you are able to handle a severe diet or a severe calorie deficit because you're not feeling hungry, your metabolism's ramped up, whatever it might be. You can lose a lot of weight quickly, but the problem is when you come off of that, there's no really good way to come off of it. Maybe there are some Medi clinics now that do teach you how to come off of it, but I've not seen a lot of them do that well. Most of these patients go in there, they're seen by a nurse practitioner, a medical professional of some sort. They get prescribed the medications and the drinks. They're allowed to eat these drinks. And then as time goes on, they lose a bunch of weight. Okay, congratulations, you graduated, here you go. You're off. Now, in Ohio, you can't be on phentermine, so I've seen these things like the Profile or the other clinics where they just put you on shakes. Here's 800 calories a day, go. In 6 months, you lose 40 or 50 pounds, whatever it might be. But you are on such a severe deficit, you've lost muscle mass, you're starving, you're fatigued, you're like no mental energy, psychological energy, no like actual energy. It's very, very, very difficult to maintain that. And I've seen people, personal people, I know them, they're my friends, personal friends that have done this in Ohio and in Illinois. And they look good, they're doing pretty well for 4, 5, 6 months, and then you see them a year later and they're back to their original weight plus another 20, 30 pounds, whatever it might be. There's no quick fix to weight loss. Or here's another one. Another female friend of mine is about probably 80 to 90 pounds overweight. They go see a doctor. They put them on phentermine, and they don't teach them anything about portion control. They don't teach them about counting calories. They don't really teach them about anything. Pay me $1,000 a month for 7 months, or whatever it might be, 3 months. Here's some phentermine. You lose 20, 30 pounds. Now you're down from 260 to maybe 180. I don't know. I'm just making this up. And then everyone's like, hey, you look good. You're doing well. What are you doing? They're talking about it. And then like a few months later, you catch them 6, 7 months later after the phentermine runs out, or they can't have it anymore because of Ohio's rules and regulations, very restricted. But you see them a few months later and all the weight is back and more. The problem is all of these diets that are like a crash diets, you put the weight back on plus more. You didn't learn any good habits. You didn't learn portion control. You didn't learn how to eat foods that are high volume but low calorie. You didn't learn any of the tips and tricks that we try to teach people along this weight loss journey. Let it take 2 years. You want to lose 30 pounds over 2 years? I guarantee you after those 2 years are up, you will have lost the 30 pounds and you will never put it back on. But if you lose 30 pounds in 2 months, I guarantee you next year or the 6, 7 months later, you'll have gained back 60 pounds. So the point is, enjoy the process. Weight loss and fitness and all that, it's a process. You want to slowly gain the tools and skills necessary to lose weight slowly, correctly, without losing lean body mass, while maybe building muscle, while getting more fit, etc., without all the shortcuts. The shortcuts is really what puts people in a bad place. So next time somebody tells you, hey, let's go to this spa, this Medi clinic, whatever, there's this great program, they put you on these pills or shakes or whatever, just stop. Sure, if you want to do that for like a quick fix, if you have something coming up, okay, it may be dangerous though. These medications are not considered always safe, and neither is 800 calories a day. But I would say, please, just do it the right way. If you're going to do this for you. Do this for your life. Don't do this for like a quick hit, quick fix, whatever. That's all I got for you. If you have questions, ask them below. I got a book on weight loss that teaches you how not to do any of this crazy stuff and how to do it properly. The link is below. Click on it and grab it.